Before inserting your scleral lenses, preparation is very important. You ready, Jeff?
I am always ready, Dr. B.
All right, great. Always start by washing your hands with soap and water, then dry them with a lint-free towel.
Common sense, right? I definitely don't want germs or little threads sticking to the lenses I'm going to be wearing in my eyes all day long.
Make sure your work surface is clean and well lit. I strongly recommend using a comfortable table or sitting area with plenty of room to work.
Yep, I've definitely found sitting at a table to be the way to go. Much more comfortable and less risk of dropping your lens. Just imagine if you lost your custom lens down the drain or hit the bathroom floor and cracked. That would not be good. Because I can't see well once my glasses are off, I like to make sure I have everything prepped before I start. I have my saline solution for filling, my handy insertion and removal tools, or as I like to say, my big plunger and little plunger, my alcohol wipe, my lens case, my nifty microfiber towel, which is great for minimizing the mess and making sure my lenses won't bounce off the table if I accidentally drop them. Trust me on this one, blinks happen and your lenses can slip off your fingers or the insertion plunger.
Let's get started. Step 1. Check the lens to make sure it looks clean and undamaged.
No cracks here. Check. I also like to make sure there's no lint stuck to my lens by giving them a quick rinse with saline. So here we are, looking fresh and ready to go.
Now for step 2, let's check the dots to ensure we're working with the correct lens. Typically, manufacturers put dots on the lens to help you tell them apart. Normally, one dot indicates the right lens, and two dots, or sometimes a red dot, would indicate the left lens. If you aren't sure, just call our office and ask.
That's good advice. Mixing up your lenses can absolutely happen. So checking the dots first will save you time. And if you ever put your lens in and your vision seems a bit off, don't panic. You probably just put the lens in the wrong eye. Remember, scleral lenses are completely custom to you and to each of your eyes.